Hey, Ms. Yamaguchi,
Hi,
sorry.
yeah.
I know I just came from your room or whatever. I ran into the doctor, and he said he finally realized how much lung history you have and everything. Got your medical records, and he wants to start another drug with you. Okay,
Oh,
now you said you never really taken any drugs before. I just gave you that albuterol. That stuff works really, really kind of more quickly and everything, but it's not going to prevent anything from really happening. It's going to treat those symptoms and everything like that. What I have here for you is a drug called advair. Really, it's two drugs mixed together. It's another long dilator to kind of keep you opened up throughout the day, and it's an inhaled steroid to kind of keep that inflammation down in your lungs and hopefully keep that breathing doing a little bit better. So the bad part about this, it's a little bit of a different technique than what we just did before. Okay, so remember with that MDI, what I have you do a nice slow deep breath. Okay, this one, so you can see it looks a little bit different. It comes in this little round disc. I'll show you some more stuff about it here in a second. It doesn't have anything, it's not pressurized. It doesn't spray the medicine out. So you do have to take a little bit of a faster breath in, okay? There's also some other things I got to show you and some other things that can go wrong with this, okay, where it can keep you from kind of getting your dose. So since I just checked all your vital signs and everything was good, I'm not going to do another assessment or anything. This is once again just meant as like a maintenance or controller type drug. So let me show you a couple of things here in case Dr. Johnson sends you home with one of these things. So you see that little thing right there, little
mm-hmm.
number. So that's a dose counter. So all these inhalers are going to let you know how many doses you have. Okay, so every time you load a dose, which I'm going to show you here in a second, you're going to see that countdown. And it just makes sure you're not doing an inhaler that's empty and you're getting the placebo effect. We want you to get real medicine. Okay,
Mm-hmm.
so what you're going to do with this, you're going to go ahead and this piece is going to swivel around and it kind of locks in place. Okay, so a couple of things here. You can see this is going to be your mouthpiece. All right, right now, see that little piece of plastic inside of there?
Mm-hmm.
It's closed, okay? So we don't have to worry about holding it upside down or blowing on it or anything like that. However, once we get ready to actually do this, what you're going to do, and I've broken these things in half for fun sometimes, there's a bunch of little individual doses of medicine inside of here. And this little lever, okay, as you push that back, that is going to puncture a dose, and there's a little dry powder that's sitting inside of there, okay? So I'm going to go ahead and I'm going to load this dose for you, all right? But because it's a dry powder, once we pull that back and that mouthpiece opens up, you can't tip it upside down. Kind of want to either hold it upright or kind of at an angle like this at the very, very most. Likewise, okay, with that other device I showed you, you could blow into it in a one-way valve. This thing, if you blow into it once we open it, it's going to powder us all, and you're not going to get your medication. Okay. So what you're going to do, I'm going to go ahead. I'm going to puncture this first one for you. Okay. We're going to keep it in this upright position. You're going to go ahead, normal exhale out. So get out the old air just like before. Seal your lips around that mouthpiece. Okay, but this one's got to be a faster breath. Okay, so really, got to pull that dry powder out of there. You're gonna take as deep of a breath as you can, and then try and get a good 10-second breath hold. Okay, so I got this punctured and ready to go. So be very, very careful with it. All right. Whoa, hey, don't blow on it. Did you see all the powder shoot out? Hang on. So what we're gonna do, because I really want you to get your dose, we're gonna say it's wasted. Even though we probably got some topical effect here. All right. So look, now that I just did all that, look, we got
Mm-hmm.
59.
Oh, mm-hmm.
I'm gonna go ahead and I'm gonna puncture it again. All right. Now we're 58. So blow off to the side. All right. Seal your lips around that mouthpiece. Nice big fast deep breath in. And hold. Oh,
I didn't taste it. Was I supposed to taste something?
let me take a look here. So one good way, since this device you do got to breathe a little bit more quickly, what I tell everybody, especially when you're first getting started out, is take a look at that mouthpiece afterwards. See how you got all that powder all over the place?
Mm-hmm.
You probably weren't breathing in fast enough, okay? You really got to try and give it a little bit more oomph there and
Okay.
everything,
Okay.
okay? So, considering that you didn't really take a good, big, fast, deep breath, let's try that one more time here,
Okay.
okay? We won't let pharmacy know about it.
All right.
I'm going to let you puncture it this time. And
Okay.
remember, blow away from it. Keep that thing in an upright position. All right. Go ahead and seal your lips. Big, fast, deep breath. Deep as you can go. And hold it. You don't have to gum the inhaler or anything like that. You just got to hold it there. I'll take that from you. um,
That was 10 seconds.
yeah, that was pretty good. So then all you're going to do, close that,
Okay.
and it's all ready to go. Okay. So once again, remember, fast deep breath with this one because you got to pull it out. Check and
Okay.
make sure that powder is not around that
Mhm.
mouthpiece. And if
Yeah.
you accidentally blow into it and it
Definitely
sprays this
tasted
off,
it that time.
yeah, it's
Mhm.
not supposed to taste good, and a lot of this does deposit in your
Mhm.
mouth, okay?
Mhm.
So that being said, this drug, I said there's two drugs in
Mhm.
there, okay? One of them's an inhaled steroid. So that steroid, if you get that powder on your tongue and in your mouth,
Mhm.
it can cause like a nasty fungal infection called thrush, and
Oh.
it's not very pleasant from what I've
Oh.
seen and what I've heard and everything like that. So I brought you a small little cup of water here. If you want to go ahead, you always want to do after that is take a nice big swig of something. All right, swish it around really good, and then spit that stuff up and out of there.
Where do I spit it at?
You can just spit it right over on the side there.
Perfect.
Okay,
Okay.
nobody's gonna walk over there or anything like that. Swish it around real good and spit that stuff. Don't swallow it down. Very good. Okay. I'll leave you with that small cup of water there. All right. I just want to check your vital signs one last time since the first time you did. I doubt anything changed. And you probably won't feel effects of that one right away, but you said you're feeling a little bit better with that last albuterol and everything
Mhm.
like that.
Yeah.
So this one would be done twice daily. Okay. So
Okay.
you were doing the albuterol in between, kind of get you feeling better on a consistent basis. And hopefully this advair is going to help kind of keep your lungs opened up and kind of prevent you from having some of those symptoms. Okay.
All right.
All right. Anything I can get for you here?
That's it. That's all I need.
All right. Well, you have fun with that small cup of water
All
there,
right. That
and
sounds
I'll see
good.
you a little later.